Oh, welcome to another Zoom call. We're trying to answer the questions. Make sure if you understand, you can chat in your questions from this point on. Otherwise, if you have questions, make sure you go to the member site, and there's multiple places where you can ask your Zoom call question. Okay, let's get to the first question. My oncologist has told me at least 5 visits that my MRI results would probably be better if I would just take tamoxifen. I listened to your videos regarding that drug and chose to take DIM U-Cell. I take 2 caps a day. Do you think that's equivalent to taking the drug? No, I don't think it's equivalent. I don't think there is a natural equivalence to taking tamoxifen, which is an aromatase inhibitor, which effectively completely shuts off all your estrogen, all your hormones. So there isn't a natural way to do uh, an aromatase inhibitor as well as a drug will do it. And that's why so many women would choose to go the natural way um, because they don't want the same exact effects, negative effects that would happen if you took the drug. I mean, why, if you just want to shut off all your hormones, why don't you just take the drug? Well, because I don't want to shut off all my hormones. I just want to shut off, the negative, the quote unquote bad estrogens. I don't want to shut down all my estrogens and all my progesterone and all my testosterone is shot, and I just feel like horrible and I have all these symptoms. I don't want to do that. Okay, well then there's not going to be a natural thing that's going to do that as well. If there was, you might as well just take the drug. So the effect of DIM and sulforaphane and IC3 and different products that are natural aromatase inhibitors, it's going to be much more gentle. It's going to be milder. So if your purpose is to really, really shut down all your estrogen in your body and really help with estrogen receptor or progesterone receptor or HER2 positive cancers, then you just might as well take the medication. But so many people choose not to do it that way, want to do a natural way, and you won't have the exact same effects, but you'll have um, the same or similar outcome. And that's the goal, right? You want to have the same outcome. So the only way to know if you're going to have the same outcome is unfortunately through trial and error. That's just the way life is. We don't know unless you can show, let's say I'm going to do a natural approach. I'm going to take DIM and other natural aromatase inhibitors. And then I do MRI in 3 months, and my cancer is worse. Then I can choose to do the tamoxifen. I can choose to go a heavier route. Well, why don't I just choose to do that first? Well, that's a choice many people do, most people do make. But then if that doesn't work, then they've maybe done damage to their body and they have some regret. So um uh it's kind of like my comment has been over the years of like, okay, should we just hit it hard and heavy? My cancer as heavy as I got, because that's many times you'll hear that an oncologist will make that statement. You have this cancer, they'll give the diagnosis, and we're going to hit this with all we got to kill the cancer. And while I'm not saying that can't be effective, that's like saying we have a sniper in New York City, so we're going to nuke the whole city. There's going to be a lot of collateral damage to hit it hard and heavy, hit it with all we got. There's going to be collateral damage that goes along with that. And are you willing to risk that collateral damage? That's not always even whether you're even willing to risk that or not. You got to look at, is that wise? Sometimes it might be, I'm not saying it's not, but is it wise for you? You got to make that decision. Concerning metastasis of cancer to the lungs. So if a person has breast cancer metastasized to the lung, liver cancer, colon cancer metastasized to the lungs, I've heard that breathing in alkaline water can help alkalize or destroy the tumors in the lungs. Do you have any suggestions about how to do this? Yeah, don't do that. You breathe in alkaline water, you'll drown. So that's not a good thing to do. It's not the alkalinity that is going to kill the cancer to the lungs, the cancer in the lungs. I would suggest hydrogen peroxide and use the hydrogen peroxide protocol that is on the homepage of the member site and use nebulized hydrogen peroxide. If you nebulize alkaline water, you're not getting the alkalinity from the water, so I would not do that. Um, you can't breathe in water, you will drown. Um, so you can nebulize things. You could nebulize a liquid cordyceps, but I don't know how much cordyceps you're getting through a nebulizer. I think your best chance is to try to kill directly is nebulized hydrogen peroxide. Hydrogen peroxide is an oxidizing agent. If you can get it to the cancer directly, you could kill the cancer. So that would be the best route, not alkaline water. My naturopath has recommended managing my groin pain by using steroids. It is not her preferred method, but nothing else has worked, and 8 months of unceasing pain has left me debilitated and worn out and unable to function in the day and unable to sleep at night. Is it safe to try steroids with bladder cancer, and would a low dose of either dexamethasone or hydrocortisone be suitable? Well, I can't tell you about the dose, but I do agree with your naturopath. So if a person um, cannot overcome their symptoms through natural means and their symptoms are debilitating, that's when medication steps in. So don't be afraid of doing medication, doing chemotherapy when it's appropriate, doing aromatase inhibitor when it's appropriate, using natural pain or using pain medication when it's appropriate. Just do things when it's appropriate. If you give it 8 months is a pretty fair shake of doing everything you possibly can to overcome your pain. If you're not sleeping, you're not going to have a good immune system. You're going to have a much more difficult time to overcome your disease if you don't get your sleep and you're in constant pain. So I would say yes. And you'll have to talk to your medical doctor about the dosage of the prednisone. Of course, just mention to your doctor that you want to start with the lowest dose. Hopefully they're willing to work with you whatever you need to do. From the chat, my last MRI is showing the following: right retrocrural lymph node structure measuring 0.7 is noted. What is this means and where is this? Yeah, so are they comparing to a previous? If you could just send me the MRI and then maybe schedule a time to talk, that would be the best thing to do. Um, hopefully this is a comparison to a previous one. The oncologist or the radiologist should have done that, if so as well. Would you use a nebulizer for hydrogen peroxide? Yep, that's what I said. You use nebulized hydrogen peroxide. What is the dosage and how often? The dosage is on the home page of the member site. There's a recipe for nebulizing hydrogen peroxide. It's a Dr. Mercola document. You have to follow that recipe exact to water down the hydrogen peroxide to the percent that you want to use in a nebulizer. So how do you dilute the hydrogen peroxide? Follow that recipe. And you make your solution following that recipe, put it in a little squirt bottle, and then make enough so that you could use it for a week. And you could do it several times a day. So you can nebulize that solution that you've created following that recipe that's on the member site, the homepage of the member site, follow that recipe, make your solution, and then you could nebulize that 2, 3 times a day. So that's how you would do that. Yes, no, it's not regular hydrogen peroxide, it's food grade that must be diluted. So follow the recipe that's on Mercola's, I have it on there. So there is no previous lymph to compare. This is the first. So send me the MRI so I can look at that, please. Many patients choose an operation to remove the tumor, and often is a part of allopathic standards of care. Once the tumor is suspect lymph nodes and suspect lymph nodes are removed and there's no visible cancer left, in my case, colorectal tumor, I understand my next step possibly of circulating tumor cells instead, dealing with circulating tumor cells and stem cells. I'm not that interested in prophylactic chemo approach. Okay, gonna stop there a second. So when a surgeon does a debulking of a tumor, let's say they debulk the tumor, let's say it's a colorectal tumor or something, and they remove that section of the colon, and they say that they feel like it was completely intact, nothing has spread beyond that. There's no visible spread via a PET scan examination. There's no visible spread via MRI or CT scan. Um, blood tests look normal. Let's say it's a breast cancer and they remove the breast. You do a mastectomy. There's no visible spread. There's no metastasis that's present. Um, Therefore, you're quote unquote cancer free or quote unquote no evidence of disease. Why would, people struggle with why would an oncologist then recommend prophylactic chemo beyond that point? Why are you asking me to do chemo when you um, when you say that there's no evidence of disease, when you say you've got it all, when the surgeon was confident that they got it all? Because the oncologist understands that long before even you were diagnosed with cancer, your tumor was giving off circulating tumor cells, or what are called cancer stem cells. So those still are present. And in order for a cancer to be picked up on a PET scan or a CT scan or MRI, it has to be 3 to 5 million cells large. So the person may already have metastasis. That doesn't mean that it's going to turn into full-blown cancer at that place. Might be a couple 100,000 cells large, and your immune system might be effectively killing it, but it might not. So could chemo help? Would prophylactic chemo help in that case? The answer is honestly yes, it could. But a lot of people don't want to do that because that can also knock down your body, it can knock down your immune system, and can cause all sorts of other issues that maybe are not appropriate for a person who's struggling with cancer. Can't I try to kill this in other ways? Yes, that's why you're doing the right. That's why you're doing all these other things. Finish a person question. As such, what blood tests or other tests do you recommend to determine the extent of these cells, the circulating tumor cells and the cancer stem cells in the body? And what are typical Connors Clinic approaches to reduce or eliminate these circulating tumor cells and stem cells? What are possible ways forward to deal with this from your holistic perspective? So that's the benefit. To me, that is the benefit of a natural approach. How do you, take a cancer that's trying to set up home and raise a family, a tumor cell circulating in your body, trying to set up home and raise a family elsewhere other than the primary tumor site, aka how do you prevent metastasis? You have to stimulate that person's immune system, do everything you possibly can, and use frequency technology, using Rife technology. Rife technology is not going to just hit the primary cancer, it's going to hit that cancer anywhere it is in the body. Well, if Rife really works, why didn't it take care of the primary tumor and just make that disappear? Well, in a lot of cases, it does. In a lot of people, it does. But lots of times, remember, you're dealing with a tumor that's multiple centimeters large. Your immune system to try to get in there and kill it, those are millions and millions and millions and millions of cells. It's difficult. It's difficult. That's why I've always said from the very beginning of ever doing cancer work, it can be beneficial to debulk a cancer. And by debulking means to remove, surgically removing or chemotherapy removing a good portion of the cancer. So it gives the immune system a better chance to kill small tumors, maybe even smaller cancers than are able to be detected on a PET scan, smaller than 3 million cells large. Your immune system, think of your immune system. How can it kill a cancer that's 2 million cells large? Is it easier to kill that or kill a cancer that's 40,000 million cells large? Think of it as what's going to be easier. Pretty commonsensical, right? So if we took away a lot of the burden, the larger mass of the tumor surgically, if that's possible, then it's easier for my immune system to clean up those other things. So I would highly suggest that you continue your natural approaches as best as possible. To answer the question as what blood tests can be done to determine the extent of these other tests, those that purport to do a circulating tumor cell test would say you should run circulating tumor cell tests. There are blood tests on the market that are circulating tumor cell tests. Why don't you advocate for circulating tumor cell tests, Dr. Connors? The reason is that it's only measuring the amount of circulating tumor cells in the blood sample. Okay, you might show zero circulating tumor cells. That doesn't mean that you haven't given off circulating tumor cells sometime in the past, which everybody with cancer has, and that those cells have set up home and are trying to raise a family in the liver and in the lungs and in some other organ. You can't measure that. So the only way can you measure the extent of circulating tumor cells in your body? No. The only thing you can measure is the extent of circulating tumor cells in that blood sample at that given time, which to me gives you really no real data that can really help you. If it's zero, you have zero circulating tumor cells. Wow, that's great. Well, yeah, that's better than having circulating tumor cells in the blood, but it still doesn't give you any data on circulating tumor cells that have migrated to other tissues and are starting to replicate or have yet to replicate in other tissues that are sitting dormant in your liver, that are sitting dormant in your lung. That doesn't give you that data. And there isn't any way to measure that. There's no medical way to measure that until the cancer, that circulating tumor cell has started to replicate and has replicated beyond 3 million cells large. Then it'll be picked up on a PET scan. Um, Even if it starts to replicate and your immune system is keeping it at bay, there's no way to measure that. So probably the best way to measure at this point, if PET scans are clean, MRIs are clean, CT scans are clean, how do you monitor this patient then? Well, follow the oncologist's recommendation to get follow-up MRIs or CT scans or PET scans that are reasonable to you, and measure tumor markers, do a tumor marker test. Well, my tumor marker tests don't show positive. Well, good. Let's just keep them monitored. That's a cheap, inexpensive, non-invasive way to measure if something jumps up. Um, and if you never showed positive tumor markers with your cancer, that doesn't mean that a metastasis wouldn't show positive tumor markers. So that's the best way to measure it. As far as a natural approach, a holistic approach is everything you are currently doing. Remember, you just removed the largest burden. Now your immune system can focus on any cleanup data, any cleanup information. Think of the burden that was on a person's immune system when the tumor was large. Not to say that we haven't had people, and lots of people have, you know, have experience of the tumor shrinking, even if it's large. But some people, it doesn't. And then debulking it is the way to go. Take that burden off the immune system so that now you can focus on getting rid of the stem cells and such. I met with my functional doctor today, and she was curious as to why you recommend that I go completely off of iodine. Since iodine is frequently recommended with breast cancer, she is not advocating for it, but simply would like to know your mind on it. So the only time I recommend iodine for breast cancer, if with kinesiology it tests well with them, and typically it's only for a relatively short period of time. Being on iodine long term um, is going to cause issues with the person's thyroid gland. Well, I thought the thyroid gland needs iodine. That's part of the thyroid hormone. It is. You get in plenty of iodine from your diet in order to deal with that. Excess iodine, excess exogenous iodine. Iodine is going to be very attracted to the thyroid and is will very commonly end up causing a Hashimoto disorder, which is an autoimmune thyroid issue. So you have to be careful with iodine. I know that there's books, I read them, books written on iodine and breast cancer. Every breast cancer person should be on iodine. I just don't think that that's correct. You have to read the studies of what iodine, exogenous iodine, does to the thyroid gland. You don't need um, comorbidities of that as well. What's the difference between doing a Dutch test and a saliva hormone test kit from ZRT? So a Dutch test is a dried urine hormone test. The saliva test is using a different format. So it depends on who you talk to. So there's advocates to the Dutch test that say that's the best way to measure hormones. There's advocates to the saliva test. There's not very many advocates anymore that the saliva test is a very accurate way to measure hormones. But the real controversy is between a Dutch test and a blood test. So a blood test can be even a little more accurate than the Dutch test, I think, except the blood test doesn't typically measure all the intermediates. Um, the Dutch test, I think, is accurate. I don't think the saliva test is a very accurate test. However, let's say the person has done saliva hormone testing and then they're retesting. Well, then maybe stick to that and continue to do the saliva testing. You can't compare a urine test to a saliva test to a blood test. They're going to be a little bit different. So whatever you've done, it's best to stick to it. I prefer the Dutch test because of the intermediates, and everything that it tests, or the cost of the test. I think it's the best test. I don't advocate for the saliva test for hormones, but the blood test, you could have argument that that could be a very good test too. Do you have any experience with the test from a Viome, which takes blood, stool, and saliva and is supposed to tell you what foods to eat, recommend supplements and probiotics? No, I'm not familiar with that test itself. Um, so no, I guess I can't answer that. I'm not familiar with that test. I live in Iowa in the midst of severe flooding. In the past month, my 21-year-old son has been doing cleanup, taking out docks, deconstructing buildings, cleaning out toxic, moldy sewage-filled basements. His boss advised him to get a tetanus shot. I believe the tetanus vaccine is only available in a DPT. He has had no vaccines ever. What are your thoughts on ways to protect against tetanus? And what are some natural ways to boost and protect your body in such conditions? Yeah, I am not in favor of getting the vaccine. I'm not in favor of getting a tetanus, even if you're exposed. Know that you're going to possibly be exposed to tetanus. There's a giant discussion involved in that. The good websites to go to about vaccines would be Vaccine Awareness. I forgot the name of it. Robert Kennedy's website on vaccines can be beneficial. The best ways to boost your body is through protection. So you boost your immune system through immune stimulants. And he's got to be wearing masks and clothing and things when you're dealing, especially with moldy sewage filled basements. The best way to protect yourself is through protecting exposure, giving yourself barriers. What are some reasons a young adult might be experiencing hair loss? Is this typical thyroid or adrenal related? Commonly thyroid. Can I ask that if you have questions about family members and such, maybe ask the questions on our Holistic Health Hour. Go to holistichealthhour.com and ask those questions so we can keep these questions related to people with cancer that are part of our program. Most common reasons for a young adult to experience hair loss would be thyroid issues. So getting a blood test for thyroid would be appropriate. Uh, During our appointment, you recommended I go off iodine completely. Why is this since iodine is completely okay? So I answered that question already. Post chemo, the PET scan, CT scan showed no tumors in December. Um, the oncologist wants me to do another PET scan, CT scan. However, my insurance has denied the PET scan. My oncologist has suggested two CT scans instead, one on my neck and one on my chest. I've been told that CTs are more toxic, less effective than PET scans. Is this true? And is it worth fighting my insurance company for a PET scan? Or are the CTs sufficient? Well, I think it'd be better to get a PET scan. So I think it'd be worth fighting your insurance company to get a PET scan and then try to stick with PET scans. Now, the struggle is if you have a certain insurance that's just going to refuse PET scans all the time and they're not going to let you do a PET scan, this is probably a 6-month PET scan, then it can be difficult, in the future. So, again, you're trying to measure apples to apples at all things when you're doing subsequent tests. So if all you're going to be able to get in the future is a CT scan, then maybe you just go ahead and do the CT scan. I don't remember off the top of my head the difference in the amount of radiation in a PET scan versus multiple CT scans, but CT scans are area specific. So your oncologist is right. And if you're going to look at multiple areas, you have to get multiple CT scans. My functional doctor, for some reason, doesn't like Dutch tests, but prefers saliva ZRT. Are you aware of something I can send her to persuade her to go with the Dutch? Um, yeah, I don't know. I mean, there's probably tons of stuff on the Dutch website. Of course, of course, they're trying to sell you on the Dutch test, so I know that it might be biased, but I'm pretty sure that they have some research on the Dutch websites. And I'm pretty sure, maybe it's not ZRT, maybe it's Doctors Data has a Dutch test too. Um, so yeah, I don't know. I don't know why your doctor likes, maybe your doctor just does the ZRT. Um, it doesn't have an account with Precision Analytics. I don't know. Um, so yeah, and so you must be, no, I don't think you're the one that asked the question about the Dutch test versus the ABR, but if you've had Dutch tests in the past, I'd suggest that you stick with it. If you've had the salivary test, then maybe just continue with that. Would it be a good idea to do blood tests for my hormones in between Dutch tests? If so, I have my yearly gynecological visit next week, and they may be willing to run them. Which tests do I ask for? Well, you ask for a complete hormone panel. Um, and certainly, if you're going to get blood tests anyhow, and if your insurance is going to cover it, get everything you can possibly get. to make sure you're getting a CBC and a complete metabolic panel, and ask for tumor marker tests to be run, and ask for everything. If your insurance will cover it, that's the best way to go. One of the tubes that connects my Rife bulb to the box was accidentally pulled out several months ago. I put it back together with electrical tape and it's been working. However, I have concerns that it might not be working correctly. I've not wanted to go without my Rife, but should I send it in to get fixed? If so, how would I go about doing that? Not sure by what you mean the tube. Are you talking about the cord that plugs into the Rife machine? So the Rife machine is that little box that says True Rife on it, F122, and you plug red to red, black to black with your bulb. Is it that came out and you taped it back together? I'm not sure what you mean. So you'd have to get a little more specific for me to answer that. If the bulb is still working, that's a good sign. It's probably fine. Um, it's, if it's, as long as it's working, it's not a problem. The only thing is if you have a faulty connection and it's not working all night and it's shorting out or something like that, you could possibly damage the machine if it's the cord. Um, so, um, yeah, I don't know. The thing to do though, if you're having issues like that, the black tubes that connect the bulb to the machine. So again, are you talking about the wires? There's tubes. There's no tubes that connect the bulb to the machine. If you're talking about the wires that connect the bulb to the machine, um, you may want to take a picture of it. With something with a fix like that, that would have to go through TrueRife. I don't have the capability of the soldering. They would probably tell you to buy a new bulb. They may want you to send pictures. That would be the most appropriate thing to do. It's hard to explain these things verbally. So they may want you to send pictures. So I would call TrueRife. I sent in a question last week. I know you were off last week, but it doesn't seem to appear here. I asked about info on MECFS for my Rife machine. I also cannot seem to find very recent old recordings. I assume they were deleted from your YouTube page. No, we got YouTube back up and running completely. So I don't know. I'll have to look if there's chronic fatigue stuff on the Rife or not. I can look tomorrow um and see and remind me, hopefully, Maureen, if you're on the phone, if you remind me to get back to her tomorrow. But on the as far as going to the old recordings of these um Zoom calls, they are on YouTube, but all the YouTube recordings of the Zoom calls are not public. So you would have to go to the member site. So you'd go to the home page of the member site, and then you go to the Zoom page. So the page that says Zoom calls. And on the Zoom call page, you scroll down and you'll see past Zoom calls. And then you follow that link to past Zoom calls, and you'll be able to see all the past Zoom calls. So members site, Zoom call page, scroll down past Zoom calls, and you'll be able to see it on YouTube. We also have our content up on our non-YouTube video channel. So remember, YouTube has been giving us all these problems. Dustin and I discussed, and he came up with the idea. We set up our own a video channel separate from YouTube. So we created our own video channel separate from YouTube, which is videos.connorsclinic.com, videos.connorsclinic.com, and they're all on there too. So all our videos are duplicated. YouTube takes down my videos like every week. It says YouTube deleted your video. Matter of fact, I got one just day before yesterday. Which one did they delete? What was it again? Let's see. YouTube. Now I'm curious. YouTube removed your content. Oh, cancer Q&A with Dr. Connors. 17 minutes into your video, I must have said something that helps people with cancer, so they deleted the content. So, yeah. So here's the link. I think everybody can see that. So, and then videos at connorsclinic.com. You'll see all the YouTube video, all our videos up there as well. Just search Zoom call and the date you're looking for. If you just search Zoom call on the videos at connorsclinic.com, videos.connorsclinic.com, you'll come up with all the different Zoom calls with the dates. Yeah, and if you have trouble with that, don't, you call the office if you need to as well. So, all right, any other questions? All right, I guess I'll get back to my garden tending. And I know multiple people have asked to share some videos or pictures of my garden. I will do that sometime. Maybe I'll put it on the member site for people to see too. And thanks for being on. We will talk again next week. Get your questions in and know that I love you all and I'm praying for all of you. Have a great week. Bye bye.